There were a lot of things that played a part in me getting an autoimmune disease. I don't put the full blame on the breast implants. It's time to talk about the boobies, the chi-chis, the tata, the girls, the breasticles, my breast implants. I've been asked to make this video since I joined YouTube 5-ish years ago, almost 6. I'm finally doing it. In the beginning, I thought it was just weird to make a video about this, but as time went on, I found that more and more people were making assumptions, attributing things to the breast implants that I personally don't, that I have conflicting views with some people. Surprise, surprise. And so I need to make a video because I really want to clarify a few things, keep people from putting words in my mouth, you know, that sort of thing. So I'm gonna try to answer all the questions that I get. I think it's best to start from the beginning. In the beginning, I had no boobies, none. I was a double A, which sounds like it would be bigger than an A, but it's not. It's smaller, flat chested. I was indeed the president of the Itty Bitty Titty Committee. And so from a very early age, I would say 16, I entertained getting breast implants. They were very popular when I was 16, you know, when I graduated high school. 2004 is when I graduated, and I knew a lot of women and girls my age that had gotten breast implants. We all went to the same doctor. Like, it was just not a big deal. A lot of people were getting them at that time. Now, that's when I wanted them, but that is not when I got them. I got them when I was 25, and the reason I made the decision finally to get them done was I saved up the money to pay for them by working a lot of extra hours, was not getting them to make a man happy. It was me and my image of myself and what I wanted to look like. I wanted to be voluptuous. I wanted to be curvaceous. I wanted to look more womanly, and I looked like a little girl, and I got told that all the time. I got confused for a high school student all the way up into my late 20s. And it also, clothes, I didn't like the way that clothes looked on me. It was all me. I just wanted to have bigger boobs. That was it. It was really simple. It wasn't this deep, complex issue. I just wanted bigger boobs, and that was it. So I got them. I went to a doctor in Paris, Tennessee, who specializes in breast implant surgery. I got saline implants. I have no idea what size. I have no idea what brand. I can't remember. That was a long time ago. It's over 10 years ago that this happened, so I don't remember a lot of things like that. The surgery went really well. I had no complications. I healed super quickly. I didn't even have bruising. I took arnica, and I healed up and was back at work within 3 days of getting my surgery done. I was an LPN at the time, so I was still doing lifting and stuff. I didn't do a whole lot of lifting. Like, my CNAs knew I'd had surgery, and so they were helping me out, but I healed very quickly, and I had no complications after the surgery. I would say it was about 2 years after I had breast implants that I started having symptoms of autoimmune issues, which I at the time had no idea that that's what was happening. I just knew I didn't feel right. I just knew something was off, but I couldn't put my finger on what it was. I just knew I didn't feel good. And it happened so far after my implants that I never connected those dots. I never thought, oh, it's because my implants, because there was a lot of other things that went down. We're gonna talk about all that in a minute though. So anyways, about 2 years after my surgery, that's when I started showing autoimmune symptoms. I didn't get diagnosed from that for another year or two. And then when I finally got that diagnosis, I was in the middle of going through IVF and IUI and trying to get pregnant because I was having infertility issues, which were related to my thyroid, which I found out at that time could be related to breast implants. At that time, getting my implants taken out was not an option. I was prioritizing getting pregnant and breastfeeding. Yes, you can breastfeed with implants. I get that question a lot. I don't really know where this myth comes from. I've never had any issues, and yeah. So that was my priority, getting pregnant, going through IVF, and being able to breastfeed once I got pregnant and had the baby. Yeah, that's what took priority. I was like, I'll get them taken out, maybe. I don't know. I'm not going to make a decision about that right now. I have a lot going on. And then I had Beckett, breastfed him successfully. I breastfed him till he was 21 months old. When he turned 2, I started looking into surgeons. I talked to a few providers that I know deal with people with autoimmune issues and breast implants, and they gave me a list of providers that specialize in explant surgery, because it's not just taking out the implant, it's a whole thing that if you get a surgeon who really knows what he's doing, they take out much more than just the implant. And that's why it's very important, if you get explant surgery, that you understand that the process is much more than just take my implant out. So that's where I started doing my research to find someone to do this surgery for me. Now, because I get asked this all the time, why have you taken so long to get them taken out? I literally have been pregnant or breastfeeding this entire time. So right when I was fixing to schedule my consultation, boom, I got pregnant. Surprise pregnancy, all natural. Was not planning on that, was not expecting that, and well, you can't get explant surgery when you're pregnant. Had Bonnie, breastfeeding Bonnie. Now I have to wait till I'm done breastfeeding. My priority is feeding Bonnie the most nutrient dense food possible, which is breast milk, if you ask me, and you're on my channel, and that means you're asking me. Okay, so breastfeeding is my priority at this moment. Now, I want to take a moment to also say, this whole time, the implants have still been inside my body. And even though I have not gotten them taken out yet, eating the way that I have for the past 5-6 years got rid of almost every single issue that I was having from an autoimmune disease that may or may not be related to my breast implants. And I think that's powerful, because not everyone can afford to just go get their implants taken out. Insurance does not cover that. So I just want to make sure, if you have implants and you are having symptoms, you already have an autoimmune disease and you're suffering, that I understand not everybody can just bounce over to the surgeon and pay however much it is for explant surgery. That's not a choice that they have currently. But I want you guys to know, if you're in that situation, changing how you eat can help improve your symptoms while you are saving up or making the decision about getting an explant, because it is surgery. Any surgery is serious. It should not be taken lightly. I didn't take getting breast implants lightly. I went in with a lot of research done on the things that I thought needed to be done. Are they dangerous? At that time, there was no information about like the risk for autoimmune disease. It just wasn't a thing. I just hadn't heard about it that much. But I went in with open eyes for the risks of surgery. Like, I was terrified that I was going to be the girl that died during a surgery for breast implants. That was a real concern for me. I am blessed to be able to afford this surgery right now. But like I said, my priority at the time for the last 5 years has been my babies and the nutrition of my babies. And so I continue to have pain, chronic pain, this whole time, because I was not willing to go through surgery and risk not being able to breastfeed my son. And then I got pregnant. Okay, so that's why it hasn't been done yet. And I got them done 10 years ago. I don't know why there's a lot of talk out there that I got them done after I started keto. I didn't start keto until 5 years ago. These are pretty freaking old. They need to be taken out anyways. Even if they weren't causing me issues, they need to be taken out. Now that brings me to breast implant illness. Okay. I don't like to be labeled with breast implant illness. So please stop saying that I have breast implant illness, because that is not an actual diagnosis. It's not recognized. It's not ICD-9. It's not ICD-10. It's not a diagnosis that can be given to you by a doctor, provider, physician, anybody. It's not a real diagnosis, okay? it is something that has become a common term that is used among those who have implants, who also have autoimmune diseases or some other form of illness. Now, that's not me saying breast implant illness isn't real. That's me saying I'm never gonna say I have breast implant illness, because I don't blame it all on the breast implants. I just don't. And also, that makes it sound like it's just breast implants that can cause these sort of issues, and it's just not true. Any sort of implant of any kind, replacement knee replacement, parts that go in for bones, like anything that is not yours, that came from your body, in your body, can cause these type of issues. And so that is why I don't say I have breast implant illness. Also, with saying that comes a community that I don't agree with everything that there's like a group and they say these things and they all kind of agree on these things, and I just don't agree with everything that they say. I don't blame my autoimmune disease solely on my breast implants, because there were other factors that went along with what happened to me. I was not living the purest life, all right? I was eating pizza and beer. I was going out all the time, staying up till 3 a.m. and going into work at 6 a.m. I was partying my butt off. I was living the 20s lifestyle. So I was eating crap, right? I was not feeding my body what it deserved to be fed. That's one. 2, trauma. I was in abusive relationships, back to back, physical and mental. I don't talk about that a lot because I just don't want to, but that definitely could have played a part in my sickness. Stress level and trauma can trigger an autoimmune disease. And yeah, I wasn't sleeping. I wasn't getting rest. I was not in a good place. And all of this happened around the same time that I got breast implants. Like, it was a staggered thing. This happened, then this happened, then this happened, then I got breast implants, then I felt sick. I think it was all of it. I think maybe the breast implants were the last straw on the autoimmune camel's back. I also had Epstein-Barr virus as well. There were a lot of things that played a part in me getting an autoimmune disease. I don't put the full blame on the breast implants. That's my experience, my life, how it played out. You can take it or you can leave it. I honestly do not care. Also, I feel like if it was just the breast implants, nothing I did would have improved my symptoms. Nothing I did would have improved my thyroid. Nothing I did besides getting my breast implants taken out would have helped me. So it had to be more than that, or I would still be as sick now as I was in the beginning before I started taking out all the toxins in the food and really diving deep into elimination diets and finding out what triggered my symptoms the most. So, like I said, I'm going to continue to breastfeed Bonnie as long as I feel comfortable doing so. Could be a year, could be 2 years. I don't know. We'll see how it goes. And then I will go get them taken out. I have made the decision based on multiple factors. The consistent chronic neck and back pain that still really plays a part in my everyday life and hinders my sleep. My left implant seems to have shifted a bit and sometimes causes me pain in that area. And I just don't like them anymore. Also, it has a little bit to do with I just don't like big boobs anymore. I'm over that big boob thing. I'm fine with having no tatas or just bitty 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 tatas, because that's probably what I'm gonna end up with. Before I end this video, some of you had questions for me over on Instagram. If you're not following me on Instagram, go do it right now. We have some fun over there on Instagram, so I'm gonna take some of those questions right now. First one says, why would you do that to yourself? This is from a man, by the way. Because I wanted to. And I think I've already gone over why I wanted to. And yeah, that's kind of that. Next, are you replacing them for something smaller or removing them altogether? Yeah, I won't be reintroducing another size implant or implants of any kind. I will just be having them removed, everything removed associated with the issues that I'm having, including scar tissue, any fragments or anything that's happened in there that I just am not aware of. Next question, breast cancer doesn't require implants for reconstruction. Should you do it? I think she means if a breast cancer survivor wants to have implants, should they do it? Again, I think that's a deeply personal issue, and I just strongly encourage you to be educated about the decision. And it's not for me to tell anybody what to do or what not to do. I just want women to be in the know and understand the pros and the cons, and that there are risks with anything, with literally anything that you do to your body, any surgery that you have, there are always going to be risks. And that's just the way that it goes. As long as you're making an informed and educated decision, I think that's the best that anybody can do. How can you breastfeed with implants? It blows my mind. This is like, I had multiple questions about this. So I had the implants that go under the muscle. I don't know if that's what kept me, but that's the very first question that I asked when I went to my consultation was, will I be able to breastfeed? Because if the answer was no, I was not going to get them. Even then, before I was married and had any fathers of children in mind, was already considering that that's an important thing and I want to be able to do that. And if this is going to interfere with that, then this is just a no right here, right now. So I've never had any issues with breastfeeding either one of my babies. I'm not really sure if it's because of how they're placed or what, but no issues for me. Next question, would you consider replacing the implants for fat transplant? No, I just don't care anymore about what I'm just content with my body at this point. Looking this way or looking that way. I'm married. My husband loves me no matter what my boobs look like. So I just don't care. I will have a lift if the plastic surgeon suggests that, because there might be some stretched out skin. I mean, I don't want that. All right, I do care about that. But when it comes to size, yeah, I don't care. It's the itty bitty titty committee for me. Why did you wait so long to remove them if they caused Hashimoto's? I think I've already covered that. I didn't realize that they were an issue until I was going through fertility treatments, and that took priority. And then I got pregnant again, and that took priority. And now I'm still breastfeeding, and that takes priority. And here we are. Who did your surgery? Dr. Boyd out of Paris, Tennessee. He's a wonderful surgeon. He's a wonderful guy. And he did really great work. I have no complaints about the surgery. I mean, I have loved these girls, even if they caused me issues. I have enjoyed having them. He did wonderful work. This is what my before looks like. This is them. I don't have a bra on or anything. I am a 32 double D. He did a good job. I love them. I wish that they hadn't made me sick, okay? But they did, and they're shifting around and things are going on, and I just got to get them taken out. Do you regret getting them? Would you advise someone against it? No, I don't regret getting them. I regret not knowing that the potential was there to cause an autoimmune disease. I regret not doing more research, but no, I'm just not someone who has regrets. I think regrets are pointless. I have no regrets in my life whatsoever. Even the bad decisions led me to where I am, so no, I don't actually regret them. Was it worth it? Yeah, they gave me a lot of joy. I'm not gonna lie. I've thoroughly enjoyed having big boobs. I liked, especially when I first got them, like they never felt foreign to me. It never felt like these weren't mine. I didn't have any of that. I woke up and was like, yes, that is what they should have looked like in the first place. And I enjoyed them for the past 10 years. So I don't know. Was it worth it? Was it worth going through all I went through? Probably not. But I mean, what can I do now? Not, I can't go back in time. So that's kind of, those kind of questions, whatever. Would you ever recommend breast implants for Bonnie? I don't think any mom would ever recommend breast implants for any child. My mom was 100% against me getting them, but I was an adult and I didn't really care what she had to say. Have your implants impacted breastfeeding? No, again. Do you get mammograms with implants? Yeah, I think that, I'm not at the age where I get mammograms, but yes, women with implants do still get mammograms. Will there be unwanted stretched skin after the explant, and how to adjust to not having implants? So yeah, I'm pretty sure I'll have some excess skin since mine were nothing, and then like I literally went from nothing to boobs. So yeah, I'll probably have to have a lift, and that's okay. I don't mind having a lift and a scar, like whatever, it is what it is. Adjusting to not having implants, I feel like it's going to be about the same to adjusting to having them. It's just going to be like, this is weird. Huh, my clothes fit different, and there's nothing that rubs my arm when I do this, because I do this all the time. I'm just kidding. Is explant surgery as painful as implant? My implants were brutal. I'm not really sure. Like I said, my implant surgery was not painful at all, and I made a full recovery very quickly. I've heard women say that explant surgery is not as bad as implant surgery. Now, I won't know for sure until I go through it, but I will report back. What are the risks of having an explant? I'm sure they're the same as any other surgery. You know, risk of blood clot, risk of hemorrhage, risk of scar tissue, risk of nerve damage, risk of, you know, the list goes on and on. I want mine out too, but then I will be left with saggy skin. Right, so you can have a lift done, and that doesn't involve an implant. That just involves the surgeon just picking skin up and putting it back together. It's like a triangle that they cut out, and then they put the triangle back together again. How long did you have your implants when you started having symptoms? Did you have a rupture? It was about 2 years before I had symptoms, and no, to my knowledge, there has not been a rupture. They're both the same. They look the same as they did in the beginning. I need to get mine taken out, but I'm so scared. Yeah, I think that's a valid fear. Anytime you go under the knife, like I said, I was scared when I got them, and I'll be scared when I get them out, especially now I have kids, you know, so there's that, like, what if something happens? I can't pick them up for weeks at a time. What if I get an infection? Yada, yada, yada. Yeah, I have fears for sure. Did you have Hashimoto's before you got your implants or after getting them? See, this is where the line is kind of blurry. I'm not sure. I started having symptoms of low libido and hormone issues before I even got my implants. It was a lot of trauma and drama. Like, oh man, the stories I could tell you. We're not gonna go down that rabbit hole, but I started showing symptoms then. I had all these weird things. I went to 2 different providers and said, can you check my hormones? Something is weird, something is off. And this was a year before I ever had my implants. So maybe, I don't know. No one ever tested me for Hashimoto's at that time. How can you find a good explant doc? Dr. Google. I live in Austin. Right, so there is a physician in Austin that is known for being the best at explant surgeries. I will post his name in the description in case you're interested in doing a consult with him. I will be following up with him, and the other doctor is from Nashville. Do you think it's important to have the full capsule removed? Yes, I do. What do you think about fat transfer? Yeah, I'm not interested in that. When you get them removed, can you no longer breastfeed? Is that why you're waiting? So I'm not really sure, but I know that I can't do anything in the middle of breastfeeding, right? That's just not possible. There would be too much stress on my body. There would be too much trauma to moving things. It's just not an option for me. Not willing to do that. Are you having them removed due to implant syndrome? I think we've already covered that. I'm having them removed because they're 10 years old and they're not serving me, and I'm still having neck and back pain. To be clear, that is the reason I'm getting them removed. If I was feeling perfectly fine and I had no pain and no symptoms, and if they weren't shifted, I don't know that I would have them taken out. But I can't speak to that because that's not what's happening. I am having issues with pain. Therefore, I'm getting them taken out, and they're 10 years old. What do you think about a breast lift? Yeah, breast lift is a lot different than breast implants. So a breast lift doesn't actually introduce a foreign body into your body. You just get excess skin taken out, and then they pull them up where they belong. I'm actually really excited to have the chance to maybe get rid of the chronic pain that I continue to live with. I'm hopeful that the surgery will help. I will be getting an MRI probably prior to going through with the surgery, just in case there's something else going on before they open me up on a table. Freaks me out. And maybe I change my mind about some things after I get them taken out. Maybe I don't. Maybe I have the same opinion, but I think breast implants definitely played a part in my sickness, but I just cannot put the whole blame on them. And I cannot totally say breast implants are the devil and they're horrible and they're toxic and how dare you do that. Like, it's your choice. And there are plenty of women living their life with breast implants and no issues whatsoever. You just don't know about them because they're not getting on YouTube and saying, my breast implants didn't try to kill me. Those women are just living their lives. They have nothing to say about their implants except for that they love them. All right, there are women with implants that are fine. And so I just can't put all the blame on breast implants. I think it's epigenetics. I think it is lifestyle. I think that it is stress levels. I think that it is food. I think that it is a lot of factors. It's not just the breast implants. Thanks for watching. If you haven't already, smash that thumb on your way out. And if you want to watch how I live my life with breast implants and autoimmune illnesses, hit subscribe. I'm here all the time. Love you, mean it.